Next on the agenda, we have Managing Cannabis Medicines Using OnTracka. This is by Chad Walkerton. It's a video. After that, at 2:15, Dedi Meiri is going to be presenting a research update from Israel in the Minyama room over there. So if everybody could go over there after this presentation, after this video, that'd be great. Thanks very much.
Hello, my name is Chad Walkerton and I'm the founder and product CEO at OnTracka, a startup that you may have heard of. Before we get started, I want to say a few thank yous. First and foremost, a big thank you to Lucy Haslam for everything that she's done. I know how much of a challenge it's been to set this up, and with everyone here, I know I'm virtual, but a massive thank you to Lucy. I also want to thank each and every one of you for choosing to be here to listen to what I have to say today. I know some of you that are in the crowd, and I would love to be there with you, to have a drink at the bar afterwards, or to just be there to have a Q&A and to unpack some of the things that you're going to hear. And lastly, I want to acknowledge the tribal peoples, the elders from past and present, as the traditional custodians of country that we gather on today. What you can expect from me within the next 15 minutes is to have answers to these three questions. Where actually are we? Why are we here? And what does the future look like? And for context, I'm obviously not referring to the beautiful state of Queensland where you are, and I'm quite envious at the moment. I wish I was with you. But rather what you're going to hear is an account through my lens about what I'm seeing in the emerging cannabis industry in Australia. And for each of you in the room, you come with a different perspective about this. And I think a part of any analysis or interaction, it's so important to think about perspective. Perspective matters. And so perspective, you may be working in a greenhouse, you may be in the boardroom, a clinic, pharmacy, public hospital, or you may be in the community as a patient. And what you're going to hear, I imagine there's some things that you agree with. There's some things that you're aligned with. But there also may be some things that you don't align with, and that we may have some differences, and that's okay. Remembering that it comes from perspective, and it's about coming together to share these ideas to see how we can collectively move forward and what is that end destination. And I know from people that have chosen to be here to listen to this, I know that we're aligned. We're aligned in the positioning of cannabis medicine, and we're aligned in demonstrating and proving the quality, safety, and efficacy of these medicines. Now, the lens that you're going to hear me talking through is one of a patient that used cannabis medicine as a complementary treatment to the nausea, fatigue, and also the existential question that I was facing as a terminal patient. The lens you're also hearing is informed by anonymous data that has been collected through our platform that has grown at over 142% in the last 12 months. Now, with that in mind, it's probably time to look at the question of where actually are we? And so I don't know what you've heard about OnTracka. Is it that there's this new app that cannabis patients can use, but there's also these other things? So I don't know if it's cannabis or not. Maybe you heard about our bugs when we launched our MVP, and part of getting to where we are was overcoming some of the bugs. Or do you know that OnTracka as the data and research company that has proprietary technology that is purpose-built for what we call the 3 Ps: patients, prescribers, and policy? But maybe you've heard something else. Maybe you've heard that we're a company that's passionate and that we give a shit about cannabis medicine, and that we're built on a belief that cannabis medicine has the capacity to support 1 billion people in this world. But the problem is a lack of clinical data. Let's do a snapshot of where we are. While we're nudging 100,000 active patients using cannabis medicines in Australia, we are still seeing inequality with driving laws, uncertainty from insurers and government about what to do with cannabis, veterans not getting access for PTSD, athletes not integrating cannabis into their recovery or for bonding and mental health, and the majority or the mass still not adopting cannabinoid therapies to prevent, treat, or manage disease, medical conditions, and mental illnesses. Like, I imagine when you're there, it's so easy to hear about the growth of the industry, the progress that's being made in patient access. And I want to be very clear, that is great. That is progress. And at times we've got to stop and smell the roses, because what I see and where we're going is that we've got a long journey ahead. And let me demonstrate that with numbers. Last month, the Australian Bureau of Statistics released some of this information, which includes over 3/4 of Australians had at least one long-term health condition in 20 to 2021. That's 78.6% of the population. And if we break that down, 20% of the population had mental or behavioral conditions. 15% had back problems, and another 12.5% had arthritis. These were the 3 most common chronic conditions. Now think about that. Everyone in this room can see why I'm talking about those numbers and the indications where cannabis medicine can be effective. And if we tally that up, that's 11 million Australians that could be benefiting from cannabis medicine. 11 million. So when we look at where we are at the moment, almost at 100,000 active patients, what I am suggesting and what I'm outlining is that this is a sample, and we've got to widen the lens, and that is that there's 1 billion people in this world that live with pain, that struggle with PTSD, that suffer from endometriosis. I'm talking about the mums and dads that are helpless when seeing their child have seizure disorders. And then there's families like Lucy's and like mine that have faced the brutal realities of cancer. And that brings us to why we're here. You all love a why, the spark of an idea, the solution to an injustice, and the reason for the fire to burn. Some of you would have heard about my story and how I came to be someone that worked in government doing assessments based on the parenting capacity of individuals, where things like cannabis was seen through a certain lens. It was seen as a risk factor that I had to determine in working out what are the best ways forward for this child and this family. And then for me on a personal level to come from that life, to then get diagnosed with stage 4 cancer, not once, but twice. Took me 2 attempts to question my beliefs about cannabis and the appropriateness for me. I thought it's going to make me paranoid. I can't do that. That's not part of getting healthy. And I remember clearly the day everything changed for me. I was with my eldest brother, my mum, my dad, and my doctor. And on that day, I was prepared for my death. I was already a terminal patient that had gone through 13 months of daily chemotherapy, and I had a surgery that now lets me travel around the world telling young kids that a shark from Manly Beach was able to bite me, and I'm still here. You know, back then it was only about time. It was only about time, and it was getting way worse, and the story continues. But I know with our limited amount of time, I can't go into all of that because I want to focus on a key aspect that I'll now tell you about. Cannabis was integrated into my life as a very last resort. It was a why not, and it was in 2015, so the context has changed somewhat. And I was one of those patients that had my journal and I was scribbling notes to tally the days I was nauseous, the foods I ate, the exercise that I did, and the journaling to start making sense of everything that was going on for me as someone that had under 24 months to live. I mean, with all that information, who would ever have guessed that I would build an app to automate, organize, and analyze that data? So in 2015, I started taking cannabis medicine, and here's a quick timeline. Side effects left almost immediately. Within 3 days, my parents got their son back. Within 3 months, I secured employment at the Family Court of Australia. And within 5 months, I no longer needed to receive the pension or income support that I'd been receiving for 2 years. Now you can be sitting here and going, that's a wonderful story. That's exactly what we wanted to hear. But anyone who is out there at the moment that has experienced chronic illnesses knows that a situation can rapidly change. And for me, it was these 2 key moments. I moved from one medical team to the other. And I came in and I said these words: I no longer have any side effects, and it's because I'm using medical cannabis. I got told, we can't hear that. The second key moment is something I've never spoken about. Some of you may know that my mum also got diagnosed with stage 3 cancer at the same time as my first reoccurrence. Now, notwithstanding the guilt, the blame, the fear, and the pain that's associated with this, there was also a life-changing lesson about the importance of anecdotal evidence versus credible medical grade data. Now, let me repeat that again. In my darkest hour, I learned a lesson about the importance of anecdotal evidence versus credible medical grade data. And I'm going to tell you the significance of this. Now, and to pause, within these last 10 minutes, you've heard me talking about these wonderful changes, that I got my identity back, that I started working again, and I was able to take myself off the pension. And throughout that journey, the closest person to me, my mother, the person for 30 days straight, I was waking up with blood in my bed, and she was massaging me and cleaning my sheets. She was the best one to see the progress that I'd been making. But then when she was placed in a situation when she was using chemotherapy, she wouldn't utilize any of the cannabinoid medicines that were there for her. We tried oils, edibles, topicals. I just wanted my mum to be okay. I wanted her to eat. I wanted her to not be in pain, and I didn't want her to be nauseous. Now, why is this important? Now, why is this important in bringing the discussion, bringing it back to what we're talking about? Now, how many mums and grandmas are out there? How many dads and mums? How many dads, mums, aunties, uncles, brothers and sisters are out there and still don't have sufficient evidence to demonstrate the safety, quality, and efficacy of cannabis medicines? Now, how many Australians on a daily basis are going to one of the 31,000 GPs to play lottery? What am I going to get if I talk about medical cannabis? Now, how many cannabis patients are out there and going to set clinics but won't exchange that information with the GP or the specialist for fear of what's going to happen? Like, is this cannabis integrated into healthcare? Is this what we are all here for? I think we can be better. And so what happens to those patients? What happens to the patient experience? Some of them will end up at some of the clinics that you have today, and I'm happy. I know some of you there. I know the way you practice, and I'm happy for that. But what about the others? They go back to an inferior treatment plan that keeps them stuck, keeps them in depression, keeps them in pain. Like, that's not okay. What we need and what you're hearing is radical transparency. And the point that I'm getting across, and I put my hand up, I am biased about this. I am very, very biased. And that is that we've been focused on setting up an industry, but we're still yet to collect reliable, independent, and credible data on a medicine that has only recently been downscheduled. And what you're hearing about and where we need to go is a future that accelerates research and utilizes real-world evidence to fasten the process to prove the safety, efficacy, and quality of cannabis medicines. I'm getting on to the final bit of this, and that is about the future. And the future, what I propose, is based on diving into some of the data that we've collected anonymously. And let's look at how that can benefit different players in the ecosystem. Let's look at patients and the capacity to access a live database to see products that are based on a Netflix rather than a blockbuster approach. No one wants to go into the past and have something that doesn't match them. We need to think about matching to the individual, matching to their psychology and to their physiology, and looking at medical conditions and competencies to do that. Now, let's think about what significance this means to a clinic or to a company when we know for a patient that we've got a 25% increase in their tolerance in 12 months. So that means to get the same desired effect from their dosing, they need to take 25% more. You know, what does that mean for the future trajectory of your product formulation? What does that mean for maintaining your patients so they don't go anywhere else? And at a clinic level, what does that mean for care planning to manage tolerance? What about this as an example? Going into the database, same patient, same product, same dose, only a period of a week, but we see a 200% variation in symptom response. Now, what does that mean for education to patients and maybe to clinicians that are used to consistency within their medicines? What about the capacity for companies to drill into the effects of patient A taking a 10-10 compared to a patient taking a THC flower? Or the difference between a broad spectrum CBD 50 milligrams versus a full spectrum versus an isolate? At the moment, we don't have that information to drill into it. We do now. What about looking at mental health? And here's one which is controversial. Looking in to see that Delta-8 outperformed CBD at reducing anxiety for certain population groups by 30%. What about for depression? Having THC, a THC extract that reduces the feeling of depression for a person within an hour by up to 70%. Or the capacity for CBD at a certain dose to show on repeated occasions the effects at eliminating stress on a daily basis. Look, to summarize, we're talking about tolerance, education, expansion, mental health, dosing, product optimization, and the economics of getting desired patient outcomes. These are just a few. These are a few parts of the data that is essential to drive the industry forward and to make it better for all. You know, the way we capture this information, and this is just very quickly, is through a range of different products. And one of them is OnTracka Research that decentralizes research and clinical trials. And we're one of the only mobile applications that is built on the backbone of a framework that is 21 CRF Part 11 compliance. Now, if you're in the crowd and you know what that means, give me a call or hit me up after on LinkedIn, because I think there's a way we can have a conversation. And that applies for anything that you know about OnTracka, or you just want to hear a little bit more. But to close, I want to provide a summary of what you've heard about today. What you've heard about is that there's data that's available on products and the different indications. And moving forward to the future, I want you to imagine what you've just heard. And imagine when we amplify those numbers to demonstrate critical mass, when we have diversity in our data set to improve the validity, but also to improve the equality in the service provision that we can provide. And also, while having this data, what does it mean for patients, companies, clinics, and government? You know, for me, it's very, very simple. We can go down the path of the USA and we can follow in the trajectory where up to 50% of the adult population has used some sort of cannabis. But there is still a total lack of evidence about what this does. Like, think about that, knowing the population of America, we've got more than 70 million. We've got more than 70 million people that have used something, and the best information that we have is anecdotal evidence that maintains the status quo of cannabis not being integrated into healthcare. You know, the future that I believe in is one where we use the data to alleviate the suffering of the 11 million Australians that could be using cannabis medicines to prevent, treat, and maintain their health. And we can only do that by understanding the safety profile of these medicines. Importantly, and to close, I hope that my story and what I was able to see from my mother, you know, and the stigma that stopped her from taking something that could benefit her and it would have alleviated her suffering. I hope that what I'm doing and what we're all doing together makes it possible, so you don't have to sit there when you know there's something that can help the person that you love dearly, but they're not able to take it because of what they need to unlearn. I wish I was there with you today. I hope there's some things that have stimulated your thinking, and I'm really looking forward to being there with you next year. I thank you for your time, and I'm always available through any of the social channels or to get me on a call to follow up on any of this. Thank you very much.